All right, let's jump right in. Welcome to this rapid fire explainer, built specifically for all you acute care professionals out there. Today, we're going to absolutely master the WETFLAG Pediatric Resuscitation Mnemonic. Look, whether you're in the ER, the ICU, or running with the rapid response team, consider this your ultimate survival guide. So picture this. The red phone rings. You've got a critically ill child rolling through your ER doors in, exactly 2 minutes? Honestly, can you confidently calculate the exact life-saving medication dosages and equipment sizes in your head right this second? It's tough, right? Because in a pediatric code, the cognitive load is just off the charts. Doing complex math under that kind of extreme pressure? Yeah, that's a massive challenge for literally even the most seasoned clinicians. You simply cannot afford to second-guess your math when every single second counts. Enter WETFLAG. Now, this isn't just some clever memory trick. It is a universally trusted anchor for resuscitation teams all over the globe. It's designed to safely decipher those critical formulas when you need them the most. So let's break the whole thing down. We're going to start with W. W stands for weight. When putting a kid on a scale just isn't an option, you need an instant estimated body weight in kilos. You got to commit these age brackets to memory. So for infants 1 to 12 months, it's half their age in months plus 4. Moving up to 1 to 5 years, that's 2 times their age in years plus 8. And for your 6 to 12-year-olds, you take 3 times their age in years and add 7. Okay, let's move on to E, which stands for energy. You're going to use this specifically for calculating your defibrillation charges when you're dealing with shockable rhythms in a pediatric cardiac arrest. The standard defibrillation dose here is an uncompromising 4 joules per kilogram. There are no ranges to worry about, absolutely no guesswork. It is just a flat 4 joules per kilo. But wait, here's the absolutely critical safety stop you have to remember: 150. That's your absolute maximum single charge limit in joules. So no matter how much the child weighs, you never ever exceed a single shock of 150 joules. Moving right along, T is for tube size. Obviously, selecting the correct airway equipment instantly is vital. For endotracheal tube diameter, you take the child's age, divide it by 4, and then add 4 for an uncuffed tube, or actually add 3.5 for a cuffed tube. And that strict sealing we talked about, it's an 8 millimeters maximum. Now for your insertion lengths, it's age divided by 2 plus 12 centimeters for oral and 15 for nasal. Next up, F is for fluids. Now this is where you really have to split your clinical decision-making. Your standard fluid resuscitation bolus for acute shock is 20 mL per kilo of normal saline. But, and this is a big but, if the child has trauma, a cardiac issue, or severe asthma, you've got to cut that bolus in half, down to 10 mL per kilo. All right, kicking off the rapid-fire drug sequence, L is for Lorazepam. This is going to be your first-line IV emergency management for acute prolonged seizures or status epilepticus. The dose you need is 0.1 milligrams per kilogram given IV. And, just like we saw with the defibrillator energy a second ago, there is a hard ceiling here too. 4 milligrams. That is your absolute maximum dose of Lorazepam, totally regardless of the patient's weight. Next is A for adrenaline, which you'll use for cardiac arrest resuscitation or anaphylaxis. Now pay very, very close attention to the concentration here. You're administering 0.1 mL per kilogram of the 1 to 10,000 solution. Just to clarify, that's equivalent to 10 micrograms per kilogram. Getting this specific volume right? Yeah, that's literally the difference between life and death. So, the crucial point to remember is this maximum limit, 10 mL. Firmly lock that number into your brain. The maximum single dose of adrenaline is 10 mL. We do this to prevent catastrophic dosing errors. And finally, we finish up the mnemonic with G for glucose. For the rapid correction of pediatric hypoglycaemia, your dose is 2 mL per kilogram of 10% dextrose. Which brings us to your final critical threshold for the WETFLAG mnemonic, and that number is 50. You must never, ever exceed a maximum glucose dose of 50 mL. Let's wrap this up with a really crucial clinical pro tip. Calculating these numbers before the patient actually arrives, that completely strips away your cognitive stress and massively mitigates dosing errors. Seriously, run your WETFLAG the very second you get the age over the radio. The math itself is simple, but the stakes are absolute. So when those ER doors fly open, are you going to let cognitive overload dictate the outcome?